Are you seeing a lot of burnout in care workers and other staff? What's the main cause? What can agencies do differently?
I mean, I think, well, one thing I'll say on the positive side of things, we do see, staff that are looking at home care who maybe weren't before because they're burnt out from the other environments that they're in, and looking for, maybe a one-on-one experience, with us. So I think, while, we certainly don't want to see the hospitals or the nursing homes or the, senior living environments struggle to have staff either. On the home care side, I do think we're seeing folks that are burnt out from those environments come into, our home care environment. We track employee satisfaction at Beato on a quarterly basis. And so we've been, watching very, very closely. And, as I think I mentioned in one of the prep sessions, we've seen burnout really, really strongly with our schedulers. We call them client service managers. It's been a really stressful time for them, as it was already challenging to put a schedule together, but we're having to be more flexible than ever with moving hours around and helping our clients get the care that they need. But maybe the clients need to be more flexible today to get that care than they did prior. And so our schedulers are navigating those conversations on a daily basis while they're trying to navigate different levels of community transmission and PPE protocols and all the challenges that were there pre-pandemic. So our on our caregiver side, our field staff, there's intermittent periods of burnout as clients maybe have COVID or family members have COVID, et cetera. But the prolonged burnout, I think, has been felt by our service office leadership, navigating everyone, but mostly our schedulers is what our EEX data tells us. That's where the impact has been felt the most.
Yeah, man, I think those are great call outs. I think addition to add to that, just we went from being a very within the four walls type of organization to being faced with, oh, you need to go remote overnight, and we're still feeling the effects of that, and it's challenged us to really reevaluate what those remote operations might look like. I think the burnout from my schedulers, my business office folks is geography. It was just that, just pick up your stuff and go home and work. Well, it doesn't quite work that way, right? I mean, there are things that just don't work. I don't have Wi-Fi service, or I don't have a fax machine at home, or just, details like that we have an opportunity to really reassess those workflows and those things that we've taken for granted for so long. So doing a lot of work around what should those roles look like, do role mapping. And we've uncovered opportunities to create some advancement pathways for staff that we didn't previously realize, and create some efficiencies as well. So I would encourage, if you're not already, really do a robust performance improvement activity around those remote operations for your office staff that really aren't within the four walls anymore.
Yeah, there's a couple things I want to build on about what Matt and you just said, Dr. Amy Moss, and it's schedulers. And it's also the long shifts in the way in which we package. And I wonder, and I asked this back, and I know this is kind of like an ad hoc question here, so I'm throwing a curveball in, but schedulers obviously are the heartbeat of an organization. I come from a scheduling background, and you're right, it was hard before, and now it is even harder. And so I think efficiency wise, I wonder what are the things that we can do from an organization perspective to provide the right tools to drive efficiencies from a scheduler perspective. And then on top of that, is this a time when we need to start talking about the types of ways that private pay or private duty care is built out from a shifts perspective, and how it's marketed up from a client perspective? I've been reading a lot of articles, a lot of suggestions, and there's a lot of great thought leaders out there that suggest that maybe this is the time that we start to shift how that looks from a market perspective of creating longer shifts or creating more package type deals for the clients to be able to acquire, so that it's better for both the clients and for the caregivers. And I just wondered, Matt, if you had any, like if you've experienced that, or if you have anything to add on that.
I mean, I think you're spot on. I think we have to question, everything if we're going to meet the needs of the future. And, I've been talking a lot lately, Kristen, especially on the Medicaid side of the house, where, the shifts do seem to be shorter, in particular states. Home care is the only environment where we ask a long-term care provider to deliver care basically, between the hours of 9 and 1 for all of their, quote unquote patients. And so
Right.
if you could imagine trying to operationalize that inside the walls of a senior living or a long-term care, everyone would say, well, that's crazy. We can't do that. Yet that's exactly what we're asking our industry to do right now today in many states. So, I do think, working with our partners, whether it's in Medicaid waivers or with HMOs, and Todd, I saw you had put something in there around value-based. I think, changing the paradigm a little bit and learning from the efficiencies that our partners in the Medicare side of the fence in terms of how they handle scheduling and, prioritizing mornings, afternoons, but realizing that you have to be a little bit flexible around the nurses, or in this case, the home health aide or caregiver schedule. I think it's going to be a critical part of the future for us. And I think, what I would say is what we're thinking about doing differently is we're probably listening more closely, and we're trying to meet people where they are. Because, Kristen, you were a scheduler, I spent some time doing scheduling. Our schedulers have some great solutions. They see things that are happening in the market, and we have to crowdsource with them to figure out how to navigate, those difficult conversations around, we know you want to start at 9, but I have a great caregiver that's in your neighborhood and could start at 11. And how do we navigate that to make everyone's experience, better?
I think these are awesome call outs, and you can tell that both Dr. Moss and Matt have had these, intimate discussions with their team, because I see it as well, having been on the provider side and the technology side. Not a lot of people talk about the workforce shortage as it relates to the back office, whether it's scheduling or billing or other, right? And, a lot of people in our industry, from a clinician perspective, get into the industry because they're relationship driven. And so they value those relationships with their patients and their families. And, and so they still have those connections, right? Because they're still spending time with patients and families. But we don't think a lot about the scheduler, who also needs those support systems and is relationship driven, and now is working home in isolation and not having those interpersonal connections. So I love the level of conversation that's going on, because I think it just, I can feel their pain, and and they're getting it from both sides. I can tell you this, being on the provider side, that schedulers are getting a lot of pressure from the clinicians or the caregivers, and they're also getting pressure from the patients and families at the same time. And so what Matt pointed out about, moving away from, this canned 9 to 1 type of scheduling model. I know I tried to do it and failed on the skilled side. We tried a 7-day case management model. We tried, other models that would leverage afternoon or evening hours. And I'm sure Dr. Moss can tell you this better than anybody. But, you look at a hospice organization, and when the vast majority of referrals are coming in the door, it's like 5 p.m., right? And we scheduled our admission nurses, to work from 9 to 5. And we've got 7 admissions that we got to pull off between 5 p.m. and 10 p.m. So we're begging, borrowing, using, whoever we have in the office, and relying on our schedulers to go help us with that. So the level of conversation is really on point here as it relates to what we're seeing out in the field right now.